Dyspareunia is the term used to describe pain before, during or after vaginal intercourse. Pain with intercourse affects women of all ages, with young women the most likely to be affected. Menopausal and postmenopausal women due to decreased elasticity of their vaginal walls, increased vaginal dryness and narrowing of the vaginal opening. Women who have surgical menopause, removal of the ovaries because of medical reasons. If dyspareunia is not managed, it may result in a loss of sexual interest, mood changes and other psychological symptoms. There are two main types of dyspareunia, which are classified according to where the pain is. Superficial dyspareunia. This is pain on attempted penetration, which may be the result of size disparity. The erect penis is too large for the vaginal entrance, as a result of menopausal changes or dermatological conditions. Prolonged use of depomedrexate progesterone acetate, depot contraception, interferes with the body's naturally produced estrogen. An intact or thickened hymen, the membrane that partially covers the vaginal entrance. Vaginismus, spasm of the pelvic floor muscles that causes temporary narrowing of the vagina. Sexual arousal disorders, infections, Candida albicans, Trichomonas vaginalis, genital herpes. Deep dyspareunia. This is pain at the top of the vagina, often experienced with thrusting. Pain can include burning, tearing or aching sensations. This pain may be the result of a pelvic disease, such as endometriosis, ovarian cysts, or pelvic inflammatory disease, from sexually transmissible infections such as chlamydia or gonorrhea. There are many physical and psychological causes of dyspareunia. Entry pain. Pain felt at the vaginal entry may be caused by insufficient lubrication, sometimes the result of insufficient arousal, inflammation, infection or skin disorder, vaginismus, spasms, pudendal neuralgia, nerve damage in the pelvis area. Deep pain. Deep pain can be caused by illnesses or conditions, surgery or medical treatments. Emotional causes. Feeling stressed, self-conscious, depressed or afraid of intimacy can affect your libido and make sex painful. Sometimes, dyspareunia begins as a physical problem, but also affects your mental well-being and relationships, causing stress and anxiety. The stress and anxiety can then make the physical problem worse. Some women with dyspareunia may have a history of trauma, including sexual or emotional abuse. How is dyspareunia diagnosed? Medical history. Your doctor may ask questions such as, when do you feel pain? When did you first experience the pain? What sort of pain is it? How does it feel? Does it occur with every sexual experience? What triggers it? Your sexual history, surgical history and childbirth experiences may also be relevant. Pelvic examination. This is a physical examination, where your doctor will check for signs of infection, irritation or anatomical problems. This may involve gently touching the genital and pelvic area to locate the site of the pain, and inserting a speculum, a plastic instrument that allows the doctor to see into the vagina. Further tests. You may need further tests, such as a pelvic ultrasound or laparoscopy, if the cause is a condition inside the pelvis. A laparoscopy is a surgical procedure where a small incision is made in the umbilicus, navel, and a thin viewing instrument, laparoscope, is inserted to view the pelvic organs. Impact on libido. If you anticipate pain during sex, you will be anxious. Your potential to become aroused will be reduced. You will have less lubrication, and this in turn can make sex even more painful. This all interferes with your desire to have sex.